not all elbow pain is created equal. So if you're someone with elbow pain that is chronic in nature, meaning you didn't fall, you didn't hit it, you didn't do nothing, it just started to hurt one day and it's been longer than 3 months, you only feel it every once in a while, like it just kind of shows up and then it goes away and you just can't tell when that happens, or you tend to feel it while you're doing an activity, or more so you tend to feel it afterwards. Either way, your elbow pain might not just be elbow pain. So my name is Huang. I'm an occupational therapist and certified hand therapist, and I have a clinic in Miami. Let me share with you 2 stories of a patient of mine where your elbow pain isn't just your elbow pain. So I've made videos in the past, and you can go check it out. It's all on elbow pain. You have tendonitis. We know you have tendonitis, and there's ways in which to like fix it, to rehab it if you simply have a tendonitis type of issue. A lot of times we'll see people here who it just isn't like that cut and dry, right? So for example, one way to find out if you have tendonitis is like right on that bone, we press it and it hurts. Number one, we do what's called wrist extension, and then you bring your elbow out and you keep your wrist here, and then your therapist will pull it and you're gonna have this sharp pain right here. That is extremely common for tendonitis. So if you have a true muscle tendon junction type of issue where your tendon is a little irritated, there might be micro tears in it, you have a true tendonitis. Here is the thing though, sometimes your elbow pain isn't always at your elbow. And this is why a lot of times when people come to my clinic, they've already been struggling with it for like a long time. Maybe they've tried therapy and the therapy hasn't helped. And don't think anything is lost. I always tell my patients that when something doesn't work, that's actually really crucial information. So it's one of the questions I ask my patients: what have you done? What have you tried? What works? What doesn't work? And so if you're not having that type of conversation with your therapist, they could be missing a big chunk of information that they could use to help you. Right? So let me tell you 2 stories, 2 patients, 2 wildly different people. One is a teenager, he plays baseball, right? He plays baseball, and one of the things I do is I look at like their position, I analyze their activity, I break down like the movement patterns that they're normally in, and then I try to find out like, hey, what is the root cause of it? My other one is an older woman. She's probably in her late 50s, mid to late 50s, and she types a lot. She's actually on the computer all the time, and she's got really great ergonomics. So before you guys are like, well, I checked my computer screen and all that stuff, great ergonomics. She's been in this profession for 40 years, never had a problem until now. So hello, it's not the typing, right? You've done it for 40 years, not the typing. So they have similar symptoms, and so the pain is not here at the elbow. So if you touch this knob right here, this is your lateral epicondyle area, right? And so if you have true tendonitis, you'll have pain here. They have pain all along inside. So here is your olecranon. Am I dry and ashy? Let me use a marker. If I'm dry and ashy, I can draw it myself better. So here, I'll draw it on this elbow. So here is your olecranon. This is your bone. You have a lateral epicondyle, and then on this side, you have a medial epicondyle. So I teach therapists as well, and so I always draw it myself here like this too. But my patients have their pain inside their elbow. And when I check, so one of the things that I like to do is I like to rule out, do you have tendonitis, right? So it's the easiest thing. I rule it out and I say, gosh, you know, everything that I check doesn't sound like it, right? So if it's not the elbow, then one of the things that I always look at is the shoulder and the neck. And the reason why I look at the shoulder and the neck is because the lower part of your neck, right? So if you check this bump, I can't draw it myself, but if you bend your neck down you're gonna feel this nub right here. Everyone has this nub. It kind of stands out. That is C7. And so above it's C7, C6, C5. And so you have a lower cervical and then you have upper cervical. Your lower cervical part sits on top of your thoracic spine. And usually what happens is we have some nerves, all of our nerves come out of our neck, down our shoulder, down our arm, and we have what's called dermatomes, and they provide like the sensation to the skin. So it might feel painful, but it just feels like deep inside. You're like, I try to touch it and I can't find it, right? I try to stretch it and I don't feel it. You might have something going on with your neck. The other thing I look at, so this is this is C6, so you'll see C6, C7 is around here, right? So you'll feel it like how you feel the sensation wise on the back of your elbow. It's different from the front of your elbow. So without going into anatomy, could be some dermatome issues, just meaning like you've got some neck issues. Maybe it's real tight. Maybe your neck isn't moving as well. Here's what happens. People tell me this all the time. This is why I'm bringing it up to you, right? It's not that you have pain at your neck. It could just be because you don't have enough movement. There's something that's kind of pinching, compressing down on those nerves, right? So I want to encourage you not to think of the problem or the root cause as being painful, because majority of my patients don't have neck pain. They will just be like, oh, I just feel really stiff, or oh yeah, I can't turn my head all the way, but it doesn't bother me. It still could be a problem. So one of the things I always look at is the neck. And the other thing I look at is at the shoulder. So we want to make sure we're looking at the shoulder and we're saying, well, how much motion do you have, right? So we look at your shoulder blade and how it's moving. We look at the amount of motion, and we look at the quality of the motion. The quality of the motion is the most important, because people with the type of elbow pain that I'm talking about usually do not lack motion. They're like, I have all the movement in the world, right? These people that I worked with, the young teenager that was a baseball player, and the older woman, middle-aged woman like myself with elbow pain, both of them had elbow pain. Like, it always happens in groups. They literally had elbow pain. It was right here in the middle, and they had full motion. But here's the kicker. They both had cervical, so neck tightness, and then their shoulders moved, but their shoulders were tight as well. They just felt the pain down there. They just felt their pain down their elbow versus like, having pain here, right? So this is why I always explain to, my patients, and, if you've been on my channel for a little bit, sometimes the pain that you feel is the engine light of your car coming on, but you've got to take it to a mechanic to find out why the engine light is coming on, because it's not always like, oh, you need more oil, because you have motion, right? It's because something is not working out as well. Let me share with you two things that I start my patients with, and you can try it yourself, but the order in which you do things, I believe they do matter. So if you're trying some things on the internet and it's not working for you, one, you might be doing it out of order. And two, I always say you might not be doing it as well as you could, because when you, I always say when you are inside the jar, you can't read the outside label, right? So sometimes you cannot see yourself and how your shoulder blade or how your arm is positioned, because you just can't look at yourself. If you look at right here, you feel it right here. Oh, it seems like everything is moving really well. One thing I notice is my patients' shoulder blades are not where they need to be, and they're not moving as well as they could be relative to the other parts of their body. right? So so that's what I do. I look at the history. I do an activity breakdown, like what's your what's the activity that you're doing. Let me analyze it. Let me you know, find out where the other problems are, and then we'll do some hands-on. So you know, I'll feel for like what's going along with the muscles, right? I'll feel for how much tension is their neck and thoracic, and then we'll do some, you know, we'll do some hands-on therapy, right? Because we're called hands-on therapy services. We're very manual based, but here are some exercises that I give them to do. You can follow along. So your shoulders sit on top of your thoracic spine, and what happens is if your shoulder is not moving very well, then the muscles of your triceps and your biceps, they're not moving as well too, which causes a lot of that like elbow pain. And if your shoulder is not moving that well, the muscles from your shoulder to your neck and from your neck to your shoulder won't move as well. So one of the things I like to do is I like to move the thoracic spine, because when I can move the thoracic spine, it also helps to loosen up the cervical spine, the neck muscles, right? So I do what's called thoracic rotations. And this is just the way I do it because it's just, I find this to be easy. Sit down, you gotta lock your hips in, right? If you're doing it while you're standing, you're just compensating and you're not, you know, stabilizing this part to move this part. Hands on your chest, and if you can't put your hands on your chest, you can put your hands on your belly. You have to keep it here, right? You have to keep it here. I twist all the way to the right side, come back to the center, twist all the way to the left side, come back to the center, and I always go to the yummy side, to the side that feels easier. If you had 200 to do, which side would you do it to? So you want to do it to the side that feels better. Usually I do 2 sets of 10, and here's the thing, if you do to both sides, you're going to work out the imbalance and you're going to work it right back in. So just do it to the yummy side, and then there's a lot of follow-up to that too. But that's just to get you started if you are feeling some tightness, right? So outside of the thoracic rotation, this is helping you to move. The other thing we want to move is, it's called thoracic extension. So this is our thoracic spine, and it goes into extension and then it goes into flexion. So let me turn to the side. It goes into extension and then it goes into flexion. So our spine here, it moves, but it doesn't move like a ton because we have our ribs there, our lungs sit there, our heart sit in the middle. So we have other things that are very important, and you know, you're allowed to move, but it's not supposed to move like the way your arm moves, okay? So don't compare them. So I do what's called thoracic extensions. The key thing here is to put your fingers together, just relax it. You want to hook that behind your neck. If you're putting it on your head, it's not very good. You want to put it behind your neck, right? And then you want the elbows to fall forward. You don't have to squeeze like you're cracking your head open, but you don't want the elbows to be out like this. If the elbows are out like this, you tend to stretch the shoulder more than you are trying to isolate the thoracic spine. Elbows together, drive your elbows up to the ceiling and then down. Up to the ceiling and then down. Now, I prefer to do it with a chair on the back because it gives you some support, but you can try those things out. And it can help to loosen up this part, which will help to loosen up your shoulder. And then you can check and see if your elbow is a little bit better in terms of when you're doing something. As much as you can try those things on your own, I really do recommend going to a therapist who can really help you to figure out where your imbalances are. This is just something that I do at my clinic, but if you have elbow pain and nothing is helping, usually with elbow pain, the way you're describing, there's no surgery, right? You didn't fall, you didn't hit yourself, you didn't, cut anything open. So there's really no surgery for it, especially if it's not a tendonitis. So do what you will with that information, but I hope it helps you at least get started and to at least understand a little bit more about your elbow pain, and that sometimes your elbow pain isn't at your elbow. Not to say we're not going to get there, but you have to start sometimes in other places first to get some relief of your elbow, and then we also work with your elbow. So anyway, if you have any questions, leave the comments below and I'll try to make more videos like this.